Well, hello, everyone. We have Heather Jackson with us today. She's an infection prevention practitioner at Lima Memorial Health System. Now, today, she's going to talk about infections and their impact on heart health. So thanks so much for joining us, Heather.
Thank you for having me.
All right. Well, firstly, can you tell us more about the relationship between infections and heart health?
Sure. Infections can trigger an inflammatory response in the body. Chronic inflammation is known to cause damage to the blood vessels and promote the formation of plaque in our arteries, leading to conditions like atherosclerosis. This inflammatory response can also weaken the plaques, allowing them to travel through our blood vessels and potentially leading to a heart attack or a stroke.
Okay, and so you're talking about infections. So what types of infections are particularly concerning for heart health?
Infections in our mouth can lead to gum disease, and gum disease is a big risk factor for heart and blood vessel diseases. Other illnesses caused by infections can make existing heart problems worse. Some infections like flu or pneumonia can increase the risk of heart attack and stroke, particularly in people who already have an underlying heart issue.
All right. And then what long-term health issues can come from an infection, even after it's been cleared?
Sure, yeah. Bacterial and fungal infections can affect the lining of our heart chambers and valves and cause inflammation, which is known as endocarditis. Endocarditis can cause damage to the heart valves and interfere with the heart's ability to pump our blood. Some viral infections can actually directly invade the heart muscle, leading to an inflammation called myocarditis. This condition can weaken the heart muscle, potentially leading to heart failure or irregular rhythms.
Okay, so I'm guessing a lot of people will want to know this. So what preventative measures can people take to protect their heart health or a loved one's heart health from issues caused by those infections?
Absolutely, yes. We can take care of our teeth and gums. We can stay up to date with immunizations. Managing chronic diseases like diabetes that increase our risk of infection is really important. And lastly, we can seek prompt medical treatment when we think we may have an infection.
All right, Heather, all good advice. Now, if someone has concerns about the impact of infections on their heart health or their risk for infections, who can they contact?
If they have a provider, they should talk to their family provider. And if they don't, they can call the number on the screen, and we'd be glad to set them up with a primary care provider near them.
All right. Well, Heather Jackson, I want to thank you for joining us today. I do appreciate it.
Thank you.
All right. Well, don't go away because we have more when we return.